Hello, my name is Nicole Stadnick. I'm joining you from the University of California in San Diego. I'm faculty in the Department of Psychiatry there. As well, I'm a co-director of our UC San Diego Altman Clinical and Translational Research Institute Dissemination and Implementation Science Center. On behalf of my colleagues and myself, I am delighted to share with you about two projects where we used meaningful community engagement through a co-created theory of change process to promote COVID-19 testing and vaccine equity. I'd like to start by acknowledging the many collaborators, community partners, and research staff who made both of these projects possible. In addition, I'd like to acknowledge our funders at the National Institutes of Health. In today's presentation, I will provide an overview of our two projects, Stop COVID-19 California and Co-Create. I will provide an overview of the overarching community engagement methods that we used for both projects, focusing on a theory of change process that we co-created for each project. I will then walk you through the results of those theories of change and conclude with lessons learned and next steps. So our first project here is the Share, Trust, Organize, and Partner California Alliance, Stop COVID-19 California, as we locally call it. This is a National Institute of Health funded project. It's a statewide collaborative across California with the goal to reduce misinformation, increase diversity and accessibility of vaccine clinical trials, and promote vaccine uptake in the most effective underserved communities. Within just California, there are 11 academic institutions that are participating. My colleague Dr. Borshika Rabin and I are the PIs of the UC San Diego site in close collaboration with our community partner, the Global Action Research Center. Over 70 local community organizations are also part of the California Alliance. The map here shows you the diversity of our counties within California, and what the darker colors show is the population density. So as you can see in Southern California, where I am, we have the largest proportion of California residents. Our second project that I'll be sharing more about is the Co-Create project. Co-Create is funded also by the National Institutes of Health through the Rapid Acceleration of Diagnostics for Underserved Populations mechanism. And we have three aims as part of our Co-Create project. The first is to develop and iteratively refine strategies to implement a large-scale COVID-19 testing program in partnership with our Community and Scientific Advisory Board using community-driven and implementation science methods. Our second aim is to implement the testing program, and the third aim is to evaluate its implementation. And this is a screenshot from our website. We're working in close collaboration with a federally qualified health center, and again, our primary community partner, the Global Action Research Center. So within both projects, we're using a variety of community engagement methods. Our primary and driving community engagement method is through our Community Advisory Board. We have convened community advisory boards for both projects, and through a number of sessions over the past 6 months, we've co-created a theory of change that I'll provide more information about. We're also progressing through an appreciative inquiry process. In addition, we have conducted, or we are in the process of completing a needs assessment survey with our underserved communities that are the priority for these projects. And we're wrapping up with qualitative data collection related to listening sessions in multiple languages and a brainwriting exercise of our co-created COVID-19 testing program, again in multiple languages, primarily Spanish and English. So a little bit more about our community advisory boards and our meetings. Across both projects, we've included 33 members. They are community organizers, public health researchers, promotores, clinical providers, and administrators, as well as 2 policy partners. We've completed 16 meetings in total using virtual methods entirely, primarily Zoom, breakout rooms, Miro boards, which I'll show you in just a minute, and live interpretation. We've included both Spanish-speaking and English-speaking members all in the same virtual space. A few lessons learned that I'll highlight. We learned the importance of translating all materials ahead of time to encourage equitable participation across our Spanish and English-speaking members. The importance of speaking slowly, taking breaks for interpretation, the acknowledgement that technology assistance is ongoing and that members have different needs in order to be able to access the technology required for the meetings. The early evening time seemed to work well for most advisory board members. We included 2 scribes and facilitators in each breakout room to support completing activities. And we concluded each session with an end of meeting reflection that was really insightful and informative for our work. So our primary community engagement method in the first 6 months of our community advisory boards was developing a theory of change. And the theory of change is a comprehensive description and illustration of how and why a desired change is expected to happen in a particular context. It's also fondly referred to as a logic model on steroids. And each community advisory board for each project completed a theory of change focused on identifying necessary conditions for equitable COVID-19 testing and vaccination, actions to create those conditions, and a blueprint for assessing efficacy. So you can see on the left-hand side, that's a generic theory of change. We transform that into a very project-specific theory of change at the end of our 16 sessions together. So each of our sessions or meetings was guided by a similar structure. We had a focus question, ideas were generated, they were sorted into categories, the categories were named, and then they were ranked in order of importance. What you see here is a screenshot of our Miro board. Miro is an online platform that allows you to develop sticky notes. You can write into them. And then as a group, we were able to take the sticky notes and move them around into different spaces. So it was an interactive way to communicate and engage everyone within the advisory board. I'll walk you through examples of what these theory of change sessions look like, just to provide some more concrete information. So this is an example of what our Global Action Research Center facilitators would present at the start of a meeting. They would explain that there was a goal for the meeting and that we would follow a series of steps. So for this particular meeting, it was to identify factors that may contribute to disparities in access to vaccinations. And we followed these 6 steps. A focus question was presented. Individuals took time to come up with their own responses. We broke them into small groups. Then we brought them back together where the responses were sorted based on themes. And then once sorted, the whole group named each grouping based on themes reflected. So this is an example of a focus question that was used. We provided context of what was happening related to COVID, and this was specific to what was happening during the time the meeting took place in early 2021. So the focus question here was, thinking about your community, what factors might prevent someone from getting the vaccine for COVID-19? So I'll share the results of our theories of change. These were the North Stars that we were aiming towards when we were developing a theory of change for each project. For Stop COVID, it was to eliminate disparities in COVID-19 vaccinations and participation in clinical trials for underserved communities in San Diego. And then for Co-Create, the North Star was to eliminate disparities in COVID-19 testing and access to treatment, especially for families with children or who are pregnant. We identified 10 in total contributing factors for both projects. And I'll allow you to take a look at these slides afterwards. But examples included information not accessible or comprehensible due to cultural diversity. And for Co-Create, a contributing factor was housing disparities worsened by the pandemic. In terms of necessary conditions, we identified a total of 9 across both projects. Examples from STOP included a social safety net for immigrant and refugee populations, and for Co-Create, it was inclusive, community-centered, accessible testing. Each community advisory board came up with actions to create those necessary conditions, and they were related often to expanding accessibility of services. Indicators of success, I wanted to provide some examples of what this looked like. So examples included more appointments available in clinics in person and increased participation from community members and local government. This was our final theory of change for Co-Create. Our next steps are to engage in an appreciative inquiry process where we're monitoring the progress of implementing strategies developed through the theory of change process. And the CABs are asked to respond to both the successes and obstacles with feedback and suggestions. A few lessons learned that I wanted to share. Engagement takes time and resources. Community partners can become members of the research team, and we wanted to highlight the University of Illinois Chicago developed a certification program, a human subjects research program specifically for community members. Cultural humility is critical. Institutional infrastructure doesn't always support engaging those living and working and leading below the clay line in the community. And so creative solutions are needed to fairly compensate community members. And then finally, translations, interpretation and transcription in multiple language are necessary, but they can be costly, and that's important to consider in your budget. So with that, I'd like to say thank you and take questions.